My name's Mary. I'm a home health OT. You guys are following me around now? Okay, just don't get in the way, all right?
Hey, get back, Zoe. How's it going?
Hi, I'm your new OT. Can I come in?
Yeah, sure, why not?
All right. Hey, what's going on? Do you remember why I'm here to see you today?
I had a stroke, so I'm having a little bit of trouble doing things around the house. That's about it.
It sucks that he's struggling, but at least now I get to administer my favorite assessment. The assessment I'm going to be administering today is the Arner-Daughter OT ADL Neurobehavioral Impairment Scale, or the A1. The purpose of the assessment is to evaluate your performance in ADLs while also identifying the neurobehavioral impairments in the functional performance of your ADLs. The assessment consists of two parts. The first part contains the Functional Independence Scale and the Neurobehavioral Independence Scale. And the second part is the Neurobehavioral Scale summary sheet, which is an optional part to complete.
Dude, I swear this LT she talks forever.
The Functional Independence Scale focuses on the ADLs and contains 5 domains with a total of 22 items. The domains are dressing, grooming and hygiene, transfers and mobility, feeding, and communication. The Neurobehavioral Impairment Scale focuses on identifying what is causing the dysfunction through 2 subscales with a total of 77 items. Some examples of these items would be motor apraxia, unilateral neglect, and anomia.
I'm not mean, I swear. It's just, dude, she explains everything. Just get to the point.
Oh, I love explaining things to my patients. Some of the specific ADL tasks that are performed in this assessment are like this one, like putting on socks and then putting on your shoes. And it's scored on a 5-point rating scale. Oh, you want to know how the Functional Independence Scale is scored? All right, I got you. So the Functional Independence Score for ADLs is scored on a 5-point rating scale. 0 being full assistance needed, 1 being minimum to moderate assistance, 2 being verbal assistance, 3 being supervision, and 4 being independent. Part of the assessment is the Neurobehavioral Impairment Scale, and how it's conducted is observing the patient perform an ADL like he's doing right here, and determining if there's any impairments going on. Neurobehavioral Impairment Scale is scored also on a 5-point rating scale, where 0, there was no impairment observed, 1, there was an impairment observed but they don't need any assistance, 2, they require verbal assistance, 3, they require physical assistance, and 4, they are dependent. After the assessment is administered, the OT will then determine what ADLs should be focused on in their treatments and with what level of assistance.
Like, I don't even think she's that good at explaining assessments or doing assessments. Like, I struggled in the bed. She didn't even help me. She was looking at you guys the whole time.
Oh, my patient? He's so easy to talk to. I love talking to him. Did you know that this assessment was determined to be reliable and valid through research and expert opinion? The assessment is also used for individuals aged 16 and older with any deficits or impairments to their central nervous system. The main diagnosis this assessment is used for is CBA, dementia, and Alzheimer's disease. The functional interpretations for this assessment is that it provides the therapist with enough adequate information regarding the client's performance in their ADLs to be able to create their own intervention plan for them. And another functional interpretation is that it provides the therapist with a direct cause to the deficit through the Neurobehavioral Impairment Scale. The strengths of this assessment are that it is a top-down assessment that is client-centered because it focuses on the occupation first. This assessment is also quick to administer for only 25 minutes. It also covers a wide variety of ADLs to allow the therapist to observe the many different performance skills and client factors that could be affected. This assessment is used for those with neurological deficits, but the weakness of this assessment is that there's not a lot of evidence-based practice to prove that it works with other neurological deficits other than CBA and dementia. Another weakness is that it takes a 5-day training course just to be certified. All right, that's all I have time for today. I'll see you next week. Oh, how'd the assessment go? I think it went well. He did have a few deficits, but I think within a few weeks he'll be doing a lot better.
Like, I don't even know why she comes here. Like, she doesn't help me.